poor nutrition, yeah, poor nutrition, malnutrition. For Chinese words, we have special words for it. 干症, yeah, 干症. So what means malnutrition? Yeah. So malnutrition in children is a chronic disorder. So this chronic disorder generally caused by not enough nutrition taking. So like for evidence, it's not a normal way to feeding the baby, feeding the infant. For a little bit older children, that may be caused by last illness, losing appetite, then eating less, and also possible caused by other illness. But generally speaking, so that stomach function is damaged. And then Qi blood deficiency. And then poor nutrition to all of the body. Yeah, poor nutrition for the skin, poor nutrition for the bone, even for the channels and the zangfu organs. So clinical symptoms, emaciations, body weaker, yeah, body weaker. And lustreless face, yeah, pretty dull, lustreless face. Dry hair, losing lusters. And also have some like shen disorders, like irritability, and maybe kind of slow reactions that we say coordinated spirit. And certainly have an abnormal appetite. So that's generally for this illness. So generally speaking, this kind of case, yeah. So generally speaking, this kind of case, if you look here, you immediately can find their poor nutrition, like the video, pretty thinner of the arms and the leg, and the body weight less than the same age of the children. So for etiology, we're talking about a lot of reasons can cause poor nutrition in the children. So firstly, we're talking about not enough nutrition coming from the food. And the feeding way is wrong. The feeding way is wrong. And eating the things, nutrition is imbalanced. So we know some children, they may only like to eating the meat. They don't like vegetables. They don't like fruit. So that's for long term still nutrition imbalance. And also may be caused by other illness. Even after recovered from other illness, people may still eating less, poor appetite, then later on caused by poor nutrition. And also some medication may be caused. And truly some genetic deficiency kind of disorder can cause. So when we talk about poor nutrition here, we can see it happens like on the skin, on the limbs, but truly can affect the internal organs functions, especially like if we talk about the affected spleen stomach, it even causes more poor nutrition. And the spleen stomach poor nutrition, they're losing function, and they are not sending like a nutrition to other organs. So that's other organs poor nutrition also. So that's we say spleen stomach. That's the mainly organ relationship with build up of qi and blood, and getting more qi and blood. That's the body more functions. So clinical diagnosis or clinical symptoms. So basically, we can know some symptoms or signs coming from spleen and stomach deficiency, like poor appetite, and the patient emaciation. That's the mainly part. And the body weight is low than normal, generally less than 50%. Thus, we can diagnose it for this illness. So generally symptoms and signs, generally lassitude, and also sometimes children sunking their fingers. So you can see their fingers pretty narrow there. So like a bad habit. And grinding the teeth. So that sometimes happens in this kind of patient. And also can see lower limb edema because poor nutrition. And also we asked, we say TCM diagnosis. We have 4-way make diagnosis. We can ask questions. So basically they may have some like a histories relationship with not suitable food to eat or not a suitable amount of food to eat. So like some food relationship or nutrition, or maybe have some illness before and didn't truly nursing care after people getting sick. Generally say emergency, it takes some time. So basically patient have emergency like a chronic process. And when kids go to laboratory test, so basically hemoglobin is low, red blood cells is low, and the protein level is low. So that's the main. So for this illness, the first important pattern still spleen qi deficiency. That's still the main reasons. And the spleen qi deficiency symptoms and signs. So we're still talking about the shallow, loose-laced face and like a dry hair, no appetite, and even more emotions, irritability, and losing stool or constipation. So depending the situation. But generally say poor appetite, yeah, poor appetite, and then losing some nutrition. Tongue is pale, and maybe slightly greasy because water retention. Pulse is serrated. But during that time, it's not too weaker, yeah, still stronger, yeah, still stronger. So we still like last evening, they getting gradually severe and severe. So that's maybe pulse during this part stage still stronger. So spin qi defense 出来为你的 tonified spin qi and help TNT function. So generally say the points pretty similar we talked about the last evening. So still middle jaw regulating and qi tonified. Yeah, spin 5 still tonified spin qi. Bladder 20, bladder 21. That's back through of the spleen and back through of the stomach. So we still mainly use tonified technique. And this one we need a longer treatment section. So 7 days as one treatment section. Then we stop couple days. Then repeat it again. So this situation even more severe compared with last illness. They got some poor nutrition already. Then we talking about another pattern. Yeah. Another pattern, accumulation kind of type of malnutrition. So we talking about the accumulation type here. So basically, they still severe kind of emaciation and shallow face, yeah, shallow complex, abdominal distension. So that's coming from accumulation, stagnation in there. And even with some veins in the abdominal. So I will see some people with emaciation but big belly. So that's basically coming for this patient. So in this kind of case, you can see the V in there. So this kind of situation pretty commonly happens with some special kind of parasite infection, big belly with the V. And poor nutrition, dry hair, and some stagnation cause the restless and sleep poor, and some abnormal behaviors. Yeah, thin on the body part, yeah, on the limbs, yeah, thin on the body part, on the limbs. So big belly here is not means they have malnutrition. They may have some water retention there. But the muscles still weaker, yeah, muscles still weaker, still thinner, yeah. So that's the situation, yes. And still poor appetite, yeah, poor appetite. And don't want to eat. or maybe sometimes the children have special kind of habit. They eat special kind of things, materials, like some children especially eating stone, or maybe they eating some cross. So these kind of condition, yes, strange kind of habit condition. One reason may be still caused by parasites. Yeah, parasite infection can cause. Another reason possible, like their body losing minerals, some kind of mineral deficiency. So people eating stone, eating for the earth, and sometimes they try to eating the metals. So that's some special or strange habit may cause. So looking for the tongue is spelled tongue, and the greasy tongue coating because spleen TNT not working, and the accumulations basically is kind of phlegm or dampness accumulations. Pulse deeper means internal disorder, but threatened and sleepy. That's kind of water retention. Treatment principle with dispersing accumulations, regular spleen. So mainly we still go to middle jaw regulating and qi tonified, spleen tonified, and generally say these kind of patients, they may have some heat accumulation. So we can clear some heat from LI11. And LI4, large intestine, South points, and also qi move. So accumulation kind of problems, we can use it. And also we can go to bladder 20, bladder 21, still back through. And actual points, Pigan, yeah, actual points, Pigan. So that's basically can treat these kind of problems. And for like not that severe kind of whole nutrition. So basically, which is even technique, not stronger stimulation, and don't keep the needle there. And if patient have restless and sleep problems, adding hard points, hard 7, and also you can add in Pacardin 6, help people to sleep. If spleen deficiency and more abdominal distensions, whole nutrition, whole nutrition, spleen deficiency, like we're talking about this kind of situation, also may be caused by the parasites. We have our actual points we call 四缝. So 四缝 on the fingers, 4 points on the fingers. So that we can specially treat these problems. So Pigan, I forgot that point location. It's on the back. Maybe not that in the book. Let's try to find it here. Yeah, diamond book not including all the actual points, but you can check in like the CTCMA list. they specially list actual points. Yeah, on the back, below the L1, yeah, below L1, 3.5 away. So that's Malay, that's Malay. And also have different opinions. Some people say below T12, 3.5. And some people say below T11, 3.5. But generally in that pretty close there. Yeah, pretty close there. Yeah, so Malay below L1, 3.5. Different book they mention with different location. But I think most book mention below L1, 3.5. So that's for the points. Then we talking about dryness chronotype. Yeah, dryness chronotype. So that's true. Yeah, that's true. More emaciations, more dry, and dry on the skin, and even can dry hair. And sometimes can find masses. Pretty similar like we talked about the big belly. Yeah, big belly. Emaciations on the limbs part, but the abdominal part maybe have some muscles. So that's they talking about look like a big person. Pale face, yeah. Poor spirit, yeah. So basically, poor nutrition, yeah, poor nutrition. They couldn't nourishing to the skin, couldn't nourishing to the hair, and couldn't nourishing function. So that's poor spirit, yeah, poor spirit. And children maybe cry, but weaker kind of cry. And the sunken abdominal area. So we say we can have both conditions, maybe big belly there, maybe sunken abdominal there. So that's totally depending the situation. If big belly is more water retention, but poor nutrition is pretty sunken in the abdominal area. And poor appetite, yeah, poor appetite, losing stool or constipation. Pale tongue, deficiency tongue, and tender, usually is less coating. Pulse is weaker and threatened. So that's more poor nutrition, yeah, more poor nutrition. So we still mainly tonify the qi and tonify the blood or nourishing the blood. So the points, yeah, points pretty similar, yeah, pretty similar. So we still go to middle jiao, ren 12, and ren 6, qi 25, stomach 36, generally 25, speed 6, and also back shu. And also we still can go to Pigen. Yeah, Pigen is kind of whole nutrition or even cause some stomach masses or abdominal masses. So still use kind of tonified technique or even technique. And they still can use 7 days with a section. Yeah, with a section. So that's basically, yeah, basically for this one. Then we talking about the prevention. So any kind of case problems, we will talk about prevention. So the mainly problems caused poor nutrition. That's the not enough nutrition. Feeding way is wrong. The feeding way is wrong. Or maybe quality of the food is wrong. So we just go to regular feeding the baby and adding different kind of nutrition for the babies. So that's the main way. So we say when the infants over 6 months, yeah, certainly before 6 months, usually only drink for the milk because they couldn't digest it for others. But start from 6 months, we can add in something like egg yolk, yeah, egg yolk, and gradually adding some other nutrition. Gradually some rice, some granuled kind of meat, or maybe fish. So gradually adding nutrition. So generally say, after 1.5 years, should be stopped like breastfeeding. Yeah, should be stopped. Start from 1 year to 1.5 years. So basically after 1.5 years, the milk coming from the mom's nutrition will be decreased. And the baby like need more and more nutrition because they growing pretty faster. So that's only eating milk is not good enough for them. And also for the kids, if they like always breastfeeding, they pretty like holding in the moms by the moms, and they whatever they hungry or not hungry, they just try to get the milk, and then they don't want to eat other food. So start from 6 months, we adding some other food. Start from 1 year to 1.5 years. Try to stop feed by the breast by the mom. So that's basically. And also we regulate for suitable time for the sleep and for activity, some physical activities, enjoy the sunshine, fresh air, and for breastfeeding the infants with the regular time, and gradually adding some other food. And also watching the body weight of the infants. So if the body weight couldn't matching their months or years, so basically, and also if they decrease the appetite, basically that should be some problems in there and get a treatment immediately. So that's the mainly one. Try to find the problems as soon as possible and then easily to treat it. Then we're talking about nursing care. So if children have these problems, malnutrition and poor digestion function due to spleen and stomach kind of deficiency, so we even more be careful the food they eating, because they eating too much damages stomach function. They eating too less, they will not enough nutrition. So that's we say we pay attention for the food. And when we adding other food, not too quickly, like we talking about, start from 6 months, we can adding egg yolk, and then gradually adding others, not too quickly. The children will not able to digest that too much food. And also for good living environments and a comfortable room, comfortable temperatures, fresh air, sunshine. And if patient, the case, have severe kind of poor nutrition conditions, so nursing care will need specially keep the skin clear. Because our skin is protected our bodies. If poor nutrition, their skin is more weaker. It's pretty easily got other like a pathogen infection, and also including the orifice. We must be careful, keep it pretty clear. And also we watching the children's how high and how body weight with their aging, monitor the body weight and the height, and to preventing like poor nutrition we didn't know.